Welcome back to Forward Therapy. My name is Kelly, and first and foremost, Happy New Year. It is 2025, and you know what that means. New month, new CHT prep. We still have a few days left of January, so it is time to test your knowledge with 10 free practice questions. This is how this video is going to work. We will go through each of the questions, make sure that you commit to an answer, and then take as many breaks as you need to, pause the video as much as you need to, and then we will go back through the questions with the best possible answer for each question. So without further ado, let's get into it. Your patient comes in complaining of ulnar-sided wrist pain. When testing for lunotriquetral instability, you would use which of the following tests? A. Watson test. B. Ballottement test. C. Allen test. Or D. Piano key test. A patient presents to the clinic complaining of pain along the lateral elbow, and you decide to perform the Cosen's test for lateral epicondylosis. Which of the following best describes Cosen's test? A. With the elbow flexed and forearm in neutral rotation, the examiner manually resists wrist flexion and pronation. B. With the elbow in extension, the examiner will manually resist supination. C. With the arm pronated and elbow flexed, the examiner will resist wrist extension and radial deviation. And D. With the elbow extended and palm flat on a flat surface, the examiner will resist middle finger extension. If a patient has greater IP joint PROM with the MCP joint extended, then when the MCP joint is flexed, what structure is tight? A. Intrinsic tightness. B. Digital extensor extrinsic tightness. C. Digital flexor extrinsic tightness. Or D. The volar plate. Which of the following tests would test for subscapularis pathology? A. Neer's test. B. Liftoff test. C. Kennedy-Hawkins test. Or D. O'Brien's test. Which of the following most accurately describes the kinematics during forearm rotation? A. The ulna becomes more distally and dorsally oriented in pronation. B. The ulna becomes more proximally and dorsally oriented in pronation. C. The ulna becomes more distally and volarly oriented in supination. Or D. The ulna becomes more proximally and dorsally oriented in supination. Which of the following cells is the most critical cell in the inflammatory phase of tissue healing and removes bacteria and debris via phagocytosis? A. Neutrophils. B. Myofibroblasts. C. Macrophages. Or D. Angioblasts. You are treating a patient with a wound which upon assessment has clear, transparent, watery drainage. How would you best describe this in your assessment? A. Serous. B. Purulent. C. Serosanguinous. Or D. Sanguinous. A patient with arterial compromise would likely present with which of the following? A. Blue color, edema, and slow capillary refill. B. Dusky color and slow capillary refill. C. Blue or purple color, edema, and rapid capillary refill. Or D. Pale or dusky color, rapid capillary refill. Evaluation of a patient with shoulder pain reveals pain and weakness with resisted abduction as well as external rotation. They also have a positive drop arm sign when lowering the arm slowly from a position of 90 degrees scaption. Which of the following rotator cuff muscles is most likely affected? A. Teres minor. B. Infraspinatus. C. Supraspinatus. Or D. Subscapularis. A patient recently had a radial head fracture and is reporting symptoms consistent with PIN compression, including weak finger extension. What site of entrapment is most likely in this case? A. Arcata Frosch. B. Pronator teres. C, spiral groove of the humerus, or D, under the brachioradialis? You made it through all 10 practice questions. Go ahead and take a moment to pause the video, review your answers, make sure that you are committed to your answers. And now let's go back through each question and go through the rationale of why each answer is the best choice for the question. One correct answer here is B, the ballottement test. The Watson shift test is for scapholunate injuries. Allen's test is going to be to test circulation to the hands, and the piano key test is for Druge instability, DRUJ. Question 2, the best answer here is C. It is the most correct position described by the Cosen's test. You want to have the arm pronated, the elbow flexed is described in the test, and then the examiner will resist wrist extension and radial deviation. Question 3, the correct answer here is B, digital extensor extrinsic tightness. Intrinsic tightness would be when the PIP flexes more with the MCP flexed than with the MCP extended. Digital flexor extrinsic tightness would be tested with the fingers in full extension and wrist in extension. And volar plate tightness would have limited PIP extension. Question 4, correct answer here is B, the lift-off test. That is the only test described here that truly tests for subscapularis pathology. Both Neer's and the Hawkins-Kennedy tests are subacromial impingement with the supraspinatus. O'Brien's test is going to examine for possible SLAP lesion or acromioclavicular lesion. Question 5, the correct answer here is A. With kinematics of the forearm, the ulna is going to become more distally and dorsally oriented in forearm pronation, and it's going to become more proximally and volarly oriented in supination. Question 6, correct answer is C, macrophages. Neutrophils are white blood cells that fight infection and heal injuries. Myofibroblasts assist in wound healing by pulling together the wound edges, and angioblasts are cells that form new blood vessels. Question 7, correct answer is A, serous drainage or exudate. A purulent exudate would be a thick milky fluid that often leads to infection. Serosanguinous is a pink color. It's a combination of that clear with a little bit of blood in it. And sanguinous is going to be a bloody exudate. Question 8, correct answer is B. Venous insufficiency would present with a blue or a purple color and edema, because a venous insufficiency means that the blood gets pooled in the hand. It's having a hard time circulating back out towards the heart. Arterial insufficiency is that the blood is just having a really hard time getting to the hand, getting to the area, so it's going to become very dusky in color. 9, the best possible answer here is C. The tests described are really the drop arm test for supraspinatus, the positioning of resisted abduction and external rotation is sort of a full can positioning. It describes most clearly a supraspinatus lesion, or best a supraspinatus lesion. For teres minor, you would do the Hornblower's test, which is really completely different positioning. The subscapularis testing are the belly press and the Gerber lift off, so those internal rotation resistive tests. And really, infraspinatus is going to be teased out a little bit more with the resisted external rotation test and then the external rotation lag sign. And question 10, correct answer here is A, the arcade of Frosch. I realized that I totally spelled it wrong in the first time that you've seen this slide, so sorry about that. I fixed my mistake. Nerve compression at the pronator teres will most likely affect the median nerve, not the radial nerve. And the spiral groove of the humerus would be less likely anatomically with the area of the injury. And the brachioradialis is going to be more of a Wartenberg syndrome, where there will be sensory disturbances, which we know that pin compression is motor only. The posterior interosseous nerve passes through the arcade of Frosch, which is located between the two heads of the supinator in the forearm area, so very close to where that radial head fracture occurred. All right, and that is going to completely wrap up our January of 2025 practice CHT questions. Thank you guys so much for watching. I hope that this video was helpful. If you enjoyed it, please give a thumbs up, subscribe to the channel. Your support really means the world to me, and I hope that to really work with you to produce the best content and things that are the most helpful for you. So drop a comment if you have any future suggestions of videos you'd like to see, and we'll see you in the next one.